Hello and welcome viewers, you're watching In Depth with your host Kriti Mishra. India's journey towards building a healthier nation is a story of resilience, innovation and commitment. Over the past decade, the country has implemented transformative policies and initiatives that have significantly improved healthcare access, equity and outcomes. The cornerstone of this transformation has been the commitment to achieving universal health coverage, ensuring that all citizens receive the health services they need without financial hardship.
Investing in healthcare makes communities more resilient, capable and productive. Universal health coverage is about ensuring everyone, including the most vulnerable families, get access to affordable, quality healthcare, enabling them to live healthy and fulfilling lives. As India's economic growth trends upward, the Government of India has been able to focus on ensuring affordable universal healthcare so that people can enjoy health and well-being and build a Viksit Bharat by 2047. The government has launched the Ayushman Bharat Mandirs Jan Arogya Yojana on September 23, 2018 to achieve universal healthcare. It is the world's largest public healthcare scheme with crores of vulnerable Indian families enrolled in it. The National Health Policy 2017 addresses changing healthcare challenges in India as technology advances, socio-economic conditions evolve, and disease patterns shift, such as the rise of lifestyle diseases like non-communicable diseases alongside traditional infectious diseases. In line with this policy, the Mandirs Jan Arogya Yojana is one pillar of the larger Ayushman Bharat scheme launched in 2018, a health initiative designed to provide equitable health coverage, especially for rural and economically weaker sections. The other pillars of Ayushman Bharat are Ayushman Arogya Mandirs, that ensures that primary healthcare is accessible to people near their homes or through a phone call. Ayushman Bharat Digital Mission, that digitally links all health facilities from village clinics to big hospitals. It aims to develop the integrated digital health infrastructure of the country. It will connect different stakeholders of healthcare ecosystem through digital highways. PM Ayushman Bharat Health Infrastructure Mission, launched in 2021, builds robust healthcare capacity from village health centers to district hospitals. Ayushman Bharat makes quality healthcare accessible on all three levels: primary, secondary and tertiary. Let's look at the progress of Ayushman Bharat Mandirs Jan Arogya scheme. Since its launch, it has saved families over 1.52 lakh crores in out-of-pocket healthcare expenses, according to the latest Economic Survey of India, that is 2024-25. As of October 1, 2025, it has over 42 crore people enrolled, according to the Ayushman cards created for the scheme's beneficiaries. More than 86.51 lakh senior citizens over 70 years have been provided Ayushman Vay Vandana cards. Over 33,000 hospitals across the country, 17,685 public and 15,380 private are impaneled under this scheme. Let's take a look at its budget. The scheme is fully funded by Government of India and respective state and union territory governments, both sharing the costs of implementation. The union government's budget estimates have increased over the past few years, with a budget of 9,406 crore estimated for 2025-26. Ayushman Arogya Mandirs, the second pillar of Ayushman Bharat, makes primary healthcare more accessible and closer to people's homes. They are envisaged to deliver expanded range services that go beyond maternal and child healthcare services to include care for non-communicable diseases, palliative and rehabilitative care, oral eye and ENT care, mental health and first-level care for emergencies and trauma, including free essential drugs and diagnostic services. These also include primary and sub-health care centers and that are equipped with all required resources, including upgraded infrastructure, additional human resources, essential drugs and diagnostics, and IT systems. Telecommunication services are also available, including in rural areas. More than 39.61 crore teleconsultations were conducted as of September 2025. Ayushman Bharat Digital Mission. This creates unique health identification numbers for people in the healthcare ecosystem. This enables continuity of care across various levels of healthcare and the availability of services everywhere, including in remote and rural areas. Let's take a look at the progress of the scheme. More than 79 crore accounts have been created. More than 4 lakh health facilities have been registered. More than 6 lakh healthcare professionals have been registered. And more than 67 crore health records have been linked. PM Ayushman Bharat Health Infrastructure Mission. During COVID-19, Government of India responded quickly using a whole-of-government approach. The pandemic showed that India's health systems needed better facilities at all levels, from local clinics to major hospitals. To address these gaps, the PM Ayushman Bharat Health Infrastructure Mission was launched on October 25, 2021 as part of Budget 2021-22. The main goal was to fix critical gaps in health infrastructure, disease monitoring, and health research across both cities and villages so India can handle future pandemics independently. It is the largest public healthcare infrastructure scheme in India since 2005, with a total budget of 64,180 crore for a period of 2021 to 26. Of this amount, 54,205 crore is allocated for state-level programs, while 9,340 crore is for central programs. This is a major 5-year plan to upgrade India's hospitals, clinics and health research facilities nationwide, making the country better prepared for future health emergencies.
Sarve bhavantu sukhinah, sarve santu niramaya, sarve bhadrani pashyantu, ma kaschid dukh bhag bhavet. It means, may everyone be happy, may everyone be free of disease, may good things happen to everyone, and may no one suffer from sadness. This is an inclusive vision. Even thousands of years ago, when there were no global pandemics, India's vision for health was universal. Today, when we say one earth, one health, it is the same thought in action. Further, our vision is not restricted to just humans. It extends to our whole ecosystem, from plants to animals, from soil to rivers. When everything around us is healthy, we can be healthy. Friends, it is a popular notion that lack of illness is the same as good health. However, India's view of health does not stop at lack of illness. Being free of disease is just a stage on the way to wellness. Our goal is wellness and welfare for everyone. Our goal is physical, mental and social well-being. India started the journey of its G20 presidency with the theme of One Earth, One Family, One Future. We realize the importance of resilient global healthcare systems in fulfilling this vision. The once-in-a-century pandemic reminded the world of a number of truths. It showed us that in a deeply connected world, borders cannot stop threats to health. At a time of crisis, the world also saw how countries in the global south had to face difficulties and even denial of resources. True progress is a people-centric. No matter how many advances are made in medical science, access must be assured to the last person at the last mile. It was at such a time that many nations realized the importance of a trusted partner in the healthcare domain. India is proud to have been a partner to many nations in the noble mission of saving lives through vaccines and medicines. Made in India vaccines were developed by our vibrant science and technology sector. We became home to the largest and fastest COVID-19 vaccination drive in the world. We also shipped 300 million doses of COVID-19 vaccine to over 100 countries.
The National Health Policy 2017 is a comprehensive framework designed to guide India's healthcare system towards achieving universal health coverage and improving health outcomes. Its significance lies in prioritizing preventive and promotive healthcare, ensuring equitable access to quality services and addressing the needs of vulnerable populations.
The year 2017 saw the release of new national health policy of the country after a gap of 15 years. The Cabinet, in its meeting held on 15th March 2017, approved the national health policy. It addresses the current and emerging challenges necessitated by the changing socio-economic and technological landscape. The process of formulation of the new policy entailed wide consultation with multiple stakeholders and regional consultations before its approval by the Central Council of Health and Family Welfare and group of ministers. The major commitment of this policy is raising public health infrastructure progressively to 2.5% of the GDP by 2025. It envisages providing larger package of assured comprehensive primary health care through the health and wellness centers. The policy aims to attain the highest possible level of health and well-being for all ages through a preventive and promotive health care and universal access to quality health services without anyone having to face financial hardship as a consequence. This would be achieved through increasing access, improving quality and lowering the cost of healthcare delivery. The policy advocates allocating major proportion, 2/3 or more of resources to primary care and aims to ensure availability of 2 beds per 1,000 population distributed in a manner to enable access within golden hour. The policy also takes a fresh look at the strategic purchase from the private sector and leveraging their strengths to achieve national health goals and seek stronger partnerships with the private sector. Besides this, the policy also highlights finer points. Assurance-based approach. The policy advocates progressively incremental assurance-based approach with focus on preventive and promotive health care. Health card link to health facilities. The policy recommends linking the health card to primary care facility for a defined package of services anywhere in the country. Patient-centric approach. The policy recommends setting up of a separate empowered medical tribunal for speedy resolution to address disputes or complaints regarding standards of care, prices of services, negligence and unfair practices, standard regulatory framework for labs and imaging centers, and specialized emerging services. Micronutrient deficiency. There is a focus on reducing micronutrient malnourishment and systemic approach to address heterogeneity in micronutrient adequacy across regions. Quality of care. Public hospitals and facilities would undergo periodic measurements and certification of level of quality. Focus on standard regulatory framework to eliminate risks of inappropriate care by maintaining adequate standards of diagnosis and treatment. Make in India initiative. The policy advocates the need to incentivize local manufacturing to provide customized indigenous products for Indian population in the long run. Application of digital health. The policy advocates extensive deployment of digital tools for improving the efficiency and outcome of healthcare system and aims at an integrated health information system which serves the need of all stakeholders and improves efficiency, transparency and citizen experience. Private sector engagement for strategic purchase, for critical gap filling and for achievement of health goals. From 2024 to 25, India's healthcare system has undergone a profound transformation. With a people-first approach, the government has focused on making quality healthcare accessible and affordable to all citizens, especially the underprivileged and rural populations. Whether it's the world's largest healthcare insurance scheme, Ayushman Bharat, or the far-reaching e-Sanjeevani telemedicine platform, the focus has been clear: affordable, accessible, accountable healthcare for all. As India steps into Amrit Kal, the focus remains firm on inclusive, resilient and people-centric healthcare. The message is clear: every life matters, and a healthier India is a stronger India.
For healthcare leaders and organizations, this is a moment of immense opportunity to contribute to creating a robust, inclusive and sustainable healthcare system. By leveraging innovation, collaboration and a patient-centric approach, India continues to set benchmarks in global healthcare transformation. Well, viewers, that's all we had for you in this edition. Thanks for watching and stay tuned to Sansad TV. Goodbye for now from my side.
To watch more programs of Sansad TV, subscribe to our YouTube channel and don't forget to like and share them.